Journalists have to provide their viewers and listeners with accurate and up-to-the-minute information on COVID-19. Here at Media General, the newsroom is mindful of their role in this important global assignment. Portia Gabo has been practicing as a journalist for 13 years. For her, though challenging, someone definitely has to tell the story.
When the outbreak of COVID happened in Ghana, the first story that I did focused on someone who had contracted COVID-19 that had recovered. At that time, you just get government officials and health officials talking about persons that had recovered, but no one had seen them. And I wanted to move beyond the statistic to telling the story about someone that had recovered.
But how has reporting on the COVID-19 been like?
After you do the story and you come back and you feel that tingly feeling in your throat, you are wondering, hey, could this be COVID? And then you're checking up on your cameraman, or when your temperature goes up a bit, you are just nervous, and then it has that psychological impact. And then every day I keep checking myself to ensure that I don't have COVID-19.
Having worked on a wide range of social and health stories, she tells me she finds joy in bringing out issues which affects people. But one thing she wants urgently addressed, particularly on COVID-19 reporting, is stigma.
You get people calling you COVID reporter, and when you come back from assignment, everyone just wants to keep a distance from you because you're just arriving from a treatment center. And I understand my colleagues as well, I understand the public as well. Sometimes you get text messages, what the heck did you think you were doing going to a treatment center? Are you thinking about your family? Are you thinking about your children? I have all these in mind, but someone has to definitely tell the story.
Joseph Armstrong has been working as a roving journalist for 8 years. He has been at the front line reporting from open markets, communities, and some health facilities.
If a journalist do not go out there to report, I mean, who has that courage to go there? These are jobs. These are what we've been trained to do. I have this much joy stepping out there to report on such issues, because I feel that the people in our rural communities, if we do not go out there to report, how do they get educated? You understand? So for me, it is much joy for me going out there to make such. That doesn't mean that I am untouchable. I cannot be infected also by the virus.
He tells me his most challenging setback on COVID-19 reporting is when officials are not forthcoming with the right information.
Well, the challenge I have is the fact that you go out there to do a story and you meet a public official or a security personnel and you speak to them. Before you start the interviewing, they give you all the information you need, the real truth. But the moment you lift your microphone, you start interviewing them, they divert from an entire issue and they start saying things that they know very well deep down in their heart that they are not speaking the truth. The port health officers that were placed at our various borders before we even recorded our first COVID-19 case in this country, they were placed there. They know they didn't have PPEs, they didn't have the test kits. Yet when you get there, they tell you, oh, we are prepared. We are scanning everybody. Yet right in front of you, you see people crossing without being scanned.
One of his greatest fears was when he joined some health workers on a bus ride to some health facilities.
Yeah, I remember one time I did bus riding with some of the frontline workers from Kolebu. And at this point, people that work at the ICU and other places or other departments within the hospital setup, I have to ride with them and find out how their work is going. And I got in there, I mean, before I stepped into the bus, I mean, I was a little scared, because these are people that are yet to go and then have themselves washed down. And here am I interacting with them, holding the same metals they are holding, and I know very well these are people that have come into close contact with the COVID patients, and that day I was scared.
As the world acknowledges the work and impact of healthcare professionals, similar attention must be given to journalists. AC Benewa Otu, TV3, Accra.